right, take 5 seconds to pause the video, read the question, and then we'll go through the answer. All right, so we have a 26-year-old female professional cyclist. She's training for a 143-kilometer bicycle road race. She is seen by her primary care physician 1 week prior to the event for a checkup. Vital signs are shown below. Physical exam is unremarkable. So temperature, okay. Blood pressure looks okay. Heart rate 52, right? This is, again, kind of along those same lines. She's an athlete. We would kind of expect her to have some kind of physiologic bradycardia here. Respiratory rate's 10, 100% on room air. Which of the following is most consistent with the hemoglobin oxygen dissociation curve of the patient during the upcoming cycling event? Okay, so we're going to assume that the blue curve A, this curve here, is consistent with her baseline at rest. Okay, all right, so we didn't really talk a lot about the hemoglobin oxygen dissociation curve, but this is something that you're absolutely expected to be familiar with for step 1. And let's just quickly kind of go through this just to make sense of it. Now, here's what I do. When I see a graph like this where I have all of these lines and I feel like, okay, this can be very confusing, what I like to do is I like to just draw a line. Like I'm just going to draw a line right here. Okay, now we're going to pretend that I know how to draw straight lines. We're going to pretend that's a straight line going up. And the reason that I do that is because I'm trying to see, okay, how can I compare these different lines? Now I know A, let's write in here, A is this patient's baseline. So this is when the patient is at rest. Okay, so this is baseline at rest. This is what her curve is. So I take this point on the curve and I say, okay, at this arterial pressure, that is her hemoglobin saturation. Let's look at curve D. So curve D, at the same arterial pressure of oxygen, I'm going to have a lower hemoglobin oxygen saturation. Okay, now, what would that mean if I had a lower hemoglobin oxygen saturation at the same partial pressure? That would mean that I have a decreased affinity at hemoglobin for oxygen, right? There's less affinity because I have the same pressure around of oxygen, but I have less of it bound to hemoglobin, so I have less affinity. Less affinity means that there's more offloading of the oxygen or more unloading of the oxygen, right? So it's easier to get oxygen off of hemoglobin because of this decreased affinity. That's what curve D is saying. What is curve B saying? Curve B is just saying the opposite. It's saying that there's an increased affinity, right? Because for the same arterial pressure of oxygen, assuming I drew a straight line, which I didn't, but assuming it's a straight line, the increased affinity here, right, would mean that there's less offloading, which is why I have a higher oxygen saturation. There's more oxygen tightly bound to the hemoglobin. What about this purple curve? I mean, you can just extrapolate. It's even higher affinity. And this orange curve, really low affinity, right? So there's a lot of offloading. Okay, so right there, we know that patients that are exercising, right, they're going to have an increase in their VO2, their rate of oxygen extraction. Okay, and so for that reason, when we have patients that are exercising, we would actually expect them to have more offloading, right? We would expect more of the oxygen to easily kind of get into the muscle tissue because the muscle needs it. And this is evidenced by the fact that, again, when we said when we're working out, we have a lower pH, we have in the arterial side, we're going to have an increase in temperature, right? These factors both, if you just, if you're memorizing first aid, you know that these two factors in and of themselves are going to cause the curve to shift right? So you know that these two factors in themselves are going to cause the curve to shift right. Okay, so in general, the thing to kind of remember here is that when we're exercising, we have increased oxygen extraction, like we already talked about, and that increased oxygen extraction is going to come from the fact that we have more offloading of oxygen. Okay, so if I have more offloading of oxygen, I'm going to go rightward shift. So if the rightward shift would be kind of going this way, to the right of this curve. So either I'm going to end up on curve D or curve E. What's the difference here? The difference is that curve E has kind of a different shape to it. It actually, if you look here at this part, it actually starts out on the left of all these other curves, and then it crosses over and goes to the right. So what gives? Why is that curve so different? So E is referring to a very specific kind of situation. When you see this curve that's probably about half the height of these other ones that has that unique shape on the side of it, that's referring to carbon monoxide poisoning. So carbon monoxide has a really high affinity for oxygen. In fact, I would have to draw like 250 of these arrows. It has a 250 times approximately increased affinity for hemoglobin compared to oxygen. So it's much stronger binding. Now, when it binds, it's going to block oxygen's binding sites. Okay, so the more CO2 I have, the lower the max level of this curve is going to be, because I'm never going to get any higher than this line here, because all of my sites are essentially going to be blocked by carbon monoxide. That carbon monoxide is not going anywhere. It has a really high affinity. But what it does is initially the carbon monoxide, when it binds, it actually will slightly increase oxygen's affinity. So it gives it this unique appearance where you initially have what looks like this increased affinity early on, okay, before the partial pressure of oxygen gets higher. But as you can see, as that partial pressure of oxygen rises, it doesn't really change the shape of the curve like it does for these curves. It kind of just levels off really early because carbon monoxide is blocking all of those binding sites. So very unique curve, pretty high yield curve to remember is this carbon monoxide binding curve. And again, our patient doesn't have that in this presentation. We're talking about exercise. So for that reason, D is going to be the best option, best answer here. And primarily, again, because we have decreased affinity, but we don't quite have this plateau that happens right at this phase. This would be a very unusual presentation, especially with this very early increased affinity that we see because of carbon monoxide. What's another situation that you would actually get this red curve? You know, there's actually a few situations, but one big one to remember too for option D would be a patient that is exposed to really high altitudes. Okay, so this is another situation where you can see this. So if a patient's exposed to really high altitudes, they can have some component of hypoxemia, right? So they can, you know, because the FiO2 is going to be very low, so your PaO2 potentially might also be low, right? And hypoxemia in general also is going to help shift this curve to the right. All of these really go in tandem if you think about it. Acidosis, hypoxemia, right? That's going to all shift the curve to the right. And the idea is, right, if I have hypoxemia, I want to shift my curve right, because I want more offloading of oxygen, because I don't have enough oxygen in the blood, so I need more of it to get offloaded. So that makes sense, okay? Now, if I go to curve B here, it's just the opposite. It's going to be an increased affinity. What's the situation where I would want an increased affinity of oxygen? So think about your fetal hemoglobin, right? So think about fetal hemoglobin. It doesn't have your classic beta chains, right? We have these gamma chains in the fetal hemoglobin, and these gamma chains are going to have really high affinities for oxygen. Okay, so they're going to bind oxygen very tightly, and that's so that the fetus can steal some of the oxygen from mom at the site of the placenta. Okay, so that's where we'll see a curve with a higher affinity from baseline. So that would be an example, fetal hemoglobin. Finally, we have curve C here. Now curve C, you'll notice it doesn't kind of fall in the standard trajectory again. It has a little bit different shape. So curve C, it starts out pretty early with this very high slope that kind of levels off up here. So these three curves that we just looked at, so we'll say 1, 2, 3, these are all said to have a sigmoid shape. Okay, and this curve doesn't quite have that same shape, and that's because these three curves are more reflective of hemoglobin that is a tetramer. So there's cooperative binding. As one oxygen binds, there's additional affinity for more oxygen to bind, creating this kind of sigmoid shape. This shape is much more classic for something that we would see with myoglobin. Okay, so in other words, in myoglobin, we don't have a tetramer. In myoglobin, there's one oxygen that can bind, and so there is no positive cooperativity. There's not a sigmoidal shape. So you're going to have a very unique shape of the curve that's going to rise very steeply initially at low partial pressures of oxygen, because once that oxygen binds, you're already going to be completely saturated with myoglobin. And once again, D is the correct answer, again, because we want more offloading in the setting of exercise to increase our oxygen extraction efficiency. So hopefully that makes some sense.